Good day. Thanks for joining us to learn about how you should prepare and conduct a site visit. We are going to present to you some tips and tricks, and we are Niccolò Bizzarri from Rome
Thank you.
and René Verheijen from Nerac in France. What we will discuss in this quarter of an hour is why we do accreditations in training, which criteria there are for training that you will check, how the accreditation process is going, how you can prepare for a site visit, what format a site visit will have, how you should behave as a visitor, some tips and tricks for good conduct, and then, of course, how to conclude a visit, and what does it all leads up to? The FESGO Diploma. We'll explain to you. ESGO accreditations are being done for training in gynecology, but also in surgery. Today, we will be talking about accreditations in training. We have over 80 centers now in Europe that are accredited for training in gynecology, and even some centers outside Europe. The aim and the scope of the accreditation is something that you should keep in mind while doing a site visit, because this dictates the criteria of for accreditation. Of course, we should identify the qualities, the criteria of a training center. You, as visitors, should monitor the quality indicators for training. And a site visit is also a good moment to remind the centers, both the trainers and the trainees, about training principles and minimal requirements, and with emphasis, of course, on the safe training environment for the trainees. So the visit assesses the quality of training, not of care of research. But of course, we will take into account care and research that are also important features of a training center. The criteria for an accreditation as a training center that we are discussing today and that you need to assess during your site visit are dictated by the ESGO curriculum that you will have read. And that means that these criteria follow the requirements for an adequate and safe training environment. First, there is an ESGO core curriculum. The curriculum is updated now. Actually, we are now in 2025 with a second update, and it is a continuation of the basic training in gynecology, the so-called PACT by Babcock. It contains 18 modules. It's competence-based, and what is very important, and you should check that this is being used, that trainees are regularly and systematically assessed. They are the basis for individual certification of your fellow as FESGO, a fellow of ESGO. What are these criteria? We're not going to go into details, but we have quantitative criteria and we have qualitative criteria. The qualitative criteria are, for instance, that you should have a data manager, that there is an educational supervisor, that there is a training program director, the boss, and that you have the trainers courses available for your staff members, but at least for either the educational supervisor or the boss, the training program director. Obviously, you should have the availability of care for oncological patients, so there should be radiotherapy, multidisciplinary team,
That is well equipped. Yeah.
oncology nurses, and it's advisable that your hospital gives a sign that they take training in oncology serious by having a postgraduate teaching program over the hospital. And of course, there should be a quality control and audit system, which mainly means that there should be mortality and mortality registrations. You should check that the quantitative criteria are all in place. These are very well written out in our curriculum. It means that you have at least 3 staff members, that there should be at least 150 new cancer cases per year, that there should be at least 10 new vulval cancers per year, a total of 100 radical operations per year, and that there should be at least 40 cytoreductive procedures. And on top of that, that of all the operations for simple endometrial cancer, 60% of them should be done by minimal invasive surgery. Why do we have these criteria? Why do we have these numbers? That they will provide enough caseload for the fellows to be trained. If you have less numbers, you will probably give less exposure for your trainees. Apart from these explicit criteria that are also available for you in REDCap, the system that you are using to put your report in, there are also other prerequisites that are less written out. The safe training environment we have mentioned already, that there should be systematic and structured assessments that we should check in the logbook. So during your visit, you should ask the trainees to show the logbook, or you can look it online to see whether this is exactly the case. Because sometimes people say that they do assessments, but no assessments have been recorded. Modular training is also a principle of training. That means that every operation should be cut into parts, and the training should have a structure, not just walking behind you. And a presence of skills lab, of course, for operating is a prerequisite, and research facilities should be there. Otherwise, your fellows cannot publish. Now, all these data for these criteria have already been provided at application, but you should double check them during the time of the visit. And therefore, the visit contains several presentations. It's not that, of course, the center will be proud of their research or of their equipment, but it's actually for you to check whether everything is there that they say that there is there. And the visitors are therefore encouraged to check the data on sites, for instance, also in the public domain, websites, PubMed, etc. Now, these are the principles, and Nico will tell you now how you should perform such a visit.
Thank you, René. That was really, really comprehensive about the everything which come before conducting the visit. So it's important. You need to go there prepared, and once you are there, it's just let's say a double check. But a double check that needs to be done very, very thoroughly. The application process is performed by the center review. There is a central review of submitted data by the ESGO office. And then there is a site visit, which is conducted usually in a 2 days format. And the reviewing of the visiting report will be done first by the 2 assessors, and in a second instance by the entire working group of the committee. So it's now been all this process is now being digitalized, and this is something new recently developed. So there is a digitalization and online application which is easy and intuitive. We use REDCap at the moment, and it's quite user friendly, so you shouldn't have any issue with during your application. Also because you have all the criteria to be fulfilled, selected and pre-selected as a tick box.
As a site visit team, you can check all these data in the REDCap.
When you prepare your visit, during the preparation of the visit, read the application in REDCap, and you will find all the items that you will need to be fulfilled in order to have the green light and accept the visitors to make the on-site visit. You see, these are all the items that needs to be fulfilled, but as René was mentioning before, these are based on the core curriculum that has been just updated. And remember, everything about this visit focus on the training program, and more in general on the training environment where the fellows are working. And again, these are example of the red cap application process in order when you prepare the applications. Of course, visit the website like PubMed in order to retrieve information that are very useful in order to show how is your center involved in research, and this will reflect how much your fellows will be involved in first person. Once all the paperwork, now not more paperwork because it's been digitalized, have been performed and are ready, there is the travel preparations. Usually it is on expenses of the center which is hosting the accreditation, to arrange the travel expenses, the travel tickets, sometimes in most of the cases, of the two visitors from ESGO and from ENIGO, because the two visitors will be one senior and one young member of the ESGO society, and the flight tickets, and they will book the hotel usually close to the hospital or in a nice area of the city. In general, there will be a dinner or a get together on the evening before the visit. It's not mandatory, but it's nice to, how we say in Italy, get to know each other and break some ice. The format of the visit is first and every other visit, there is a one day of visit on site, and the repeat visit is usually a half a day televisit. Usually the standard format is you do one on-site visit now, and you get accreditation if everything goes well for 5 years. After 5 years you have a second visit, but it's a televisit just to check everything is going well, and there was a certain number of accredited fellows. And then after 10 years from the first visit, there will be another on-site visit. Of course, these numbers in terms of years can be changed according to the committee review. The scenario that is creates usually during the visit is that there is an introduction by the visiting team and the hosting team. Then there is a meeting with the head of the department, the director, the dean. There is a presentation of the center, and this happens usually in one meeting room early in the morning. The presentation of the center, the facilities, how the week, let's say the week program is for the fellow, how is the general management of the operating theater, how is the connection with the chemotherapy, with radiotherapy, how is the MDT working, all this practical stuff. And of the year reports, and then we will they will discuss about, of course, also the research reports, but all these steps will be followed in the application form. Then there will be a meeting with other specialities from MDT. It's very important to meet up with specialty connected with gynecological oncology, such as colorectal surgeons, hepatobiliary surgeons, vascular surgeons, urologists, psycho-oncologists, if there is the opportunity and it's well required, pathologist, radiologist, and radiotherapist, and medical oncologist if these are not part of the team. There is an important part of the meeting, which is a confidential meeting with the fellows. This is a separate meeting between the, let's say, visitors, ESGO visitors, and the fellows, where the aim is the fellows open themselves and really share their experience during the previous months or years, to understand whether the climate and the atmosphere of that center is really appropriate and adequate to consider this an ESGO accredited center for training, because what we want is our fellow to be trained in a very nice environment, and this is really the main objective of the visit. Visit of the premises, and at the end there is a drafting and the presentation of the visiting report to the team of the center. This is the, let's say, the backbones and the principles which on which our visits are based. Patient safety first always, healthcare quality, team building is crucial, supervision, we need the supervision to be explained, and we need to see that there is a hierarchical supervision, but which doesn't put not the patient at risk, well-being and professionalism. A site visit has actually two purposes: checking the criteria and reminding the training principles, thus running the risk of being too inquisitive and harsh and too school marmish. In basically, we don't want to be like, let's say, the classical school teacher. Don't be like the classical policeman. Go there. We have all been there as a center which receive accreditations. So what we suggest is to really be nice, because also this is the philosophy of ESGO. Be nice, be relaxed, and by being nice, people will approach you better, and fellow will learn better, because if they are under pressure, anyone under pressure performs worse. So let's remove the pressure and be nice, and you will obtain the info that you need to understand if that's a real center that can train real fellows from ESGO.
But address the issues,
But address the issues.
but
Yes.
in constructive way.
Don't hesitate to mention issues. Yes, of course. In a nice and constructive way, there are issues, and it's important to bring them out. What we do usually is this center was nice, was perfect. These are the pros. These are the very nice aspects, but you can improve in A, B, C, D. And if these A, B, C, D are really something that cannot be overlooked or be gone beyond, at some point that center can even not be qualified, or there is a reductive time of accreditation.
That will come back in the conclusion.
So in general, these are some pictures from our visit, the visiting team with the junior and senior together. The previous one was in Tel Aviv, and then in Paris, and then we have here in Turkey, in Spain, sorry. No, Turkey, Turkey. Memorial Sloan Kettering in New York, Leuven in Belgium. So, and these are just few of the ones that we did. Some tips and tricks shall I give? Usually organize a dinner the evening before the site visit. This will, as we said, create a nice atmosphere and start to get together. And during the dinner, the tip is try to get some information, talking to one or the other member of the team, and check that these information are consistent between themselves. Because if someone says something, some other says something else, it can be not true. At the beginning of the visit, briefly presenting the visiting team, emphasize the purpose of the visit. We are here not to judge the center, not to judge the facilities, the infrastructure, not to judge the research that you do, but to understand whether this place is a good environment and fulfill the curriculum criteria to train an ESGO accredited fellow. Talks as much as possible to the fellows, because those are our targets during the visit. This might be essential to have info on the training climate. The senior visitor should give as much question as possible to the junior to start the question, and if there are issues, try to mutually find and suggest a solution rather than just criticize.
Having performed the visit, your co-visitor is running away. Can happen. Anyway, you will have to conclude the visit alone or together, and you write down all the conclusions and all your observations in RedCap. In RedCap, you have the possibility to write down in words, or you should just click on whether all the criteria have been fulfilled with yes or no, and you can then conclude and give an advice, which your advice will be a pre-advice to the working group of fellowship, curriculum and logbook. It can be an advice of straightforward according the ESGO accreditation. It can also be that you want to give recommendations, and these recommendations can be free recommendations that need to be followed up before the next visit, but it can also be mandatory recommendations that should be fulfilled before the certificate will be issued. In the old REDCap system, you cannot make a difference between these two types of mandatory recommendations, and therefore you should write it down. In a few months' time, we will have a new REDCap system where this will be automatically clicked on, and you can click on mandatory immediately or mandatory before the next visit. Once you have given this conclusion, and this conclusion is then brought to the working group, the working group members have also approved your conclusions, then the certificate of accreditation will be issued. Very briefly, why do you need this certificate? What is it all about? It's all about giving the opportunity for you, for the center that you have accredited, for that center to build fellows. We have now almost 100 fellows that have been certified. We have over 100 fellows filling in currently the e-logbook, and that will potentially within 2 years' time finish their training. All these fellows will follow the curriculum, will therefore also having passed the exam. And this you should also during the visit stress, and you have time enough while walking through the hospital, while having dinner before, stressing all the time that their logbook of the fellows will be reviewed, and it's the responsibility of both the trainees and the trainers to complete that logbook with systematic and structural assessment. We cannot stress this more than enough. Here you see the e-logbook as it is in this moment. In a few months' time, also the e-logbook will be fully available in REDCap, so that we will use exactly the same system there. So this site visit can not only be used to assess the criteria for an accredited center, but it gives you also the opportunity to teach the center about how to train a fellow to give a successful ending to the fellows at the end of their training. Then they will get the diploma, the FESGO diploma of a fellow of ESGO, the final aim of your visit, which you will be able to see probably a few years later. Good luck with your visit. Review the slides again if you like, if you have forgotten about things, and perhaps before your next visit, quickly review the slides just once again to get some more tips and tricks. Good luck.